This is our patients tell all, um, aspect of the Global PAD Association and our Heart of Innovation broadcast. So this is a chance for everyone in our studio audience to jump in and have a conversation. And Kevin Morgan, who wrote the books, How to Train for Aging and How to Fight the Crippling Pain of Peripheral Artery Disease, both books on Amazon. Also, Kevin, they're available. What's your website? Inspirationalselfhelpbooks.com.
Yes. And if you can't get them, let me know. You can write to me if you want. You can email. Also, I have a newsletter you can sign up for on my site and ask questions directly. My email address is olddogintraining@gmail.com. And clearly, I'm the old dog.
I love it. I love it. So before we jump into patient questions, Tom or Kevin, I have a question because I don't know that, and you referenced this as well. I don't know that anyone's ever asked me if they could run a marathon, let alone do an Ironman with a AAA stent graft in, because I'm intimately familiar with those. Were there any precautions that your surgeon had recommended, or said just go? I'm assuming they wanted you to heal up a little bit, right?
Well, I mean, I have veterinary training, medical training. I'm a researcher, that helped. But no, I got no useful advice from surgeons or physicians, and I understand why. To me, it's like when I go to the garage and get my car fixed, I don't ask the mechanic to tell me how to drive. And I've got this body and it's got a stent graft, and it was up to me to work out how to drive it. First thing I did was create a blog and go out into the world to try and find other people who were doing full Ironman races with a AAA stent graft. I found no one. Therefore, being a scientist who likes to solve problems, I just thought through the mechanics and realized I needed to reduce hip flexion. I needed to keep training. I knew my times would be slower, but I don't mind as long as I'm at the start feeling good and I can finish the race. I'm quite happy. So no, I could get no useful advice from physicians or surgeons because I don't think they're in a position to do that because they have so few patients like me. Most of their patients come in and they have other health problems that prevent them from doing this, or they've never exercised and have no awareness of it. I do get frustrated with lack of interest on the part of surgeons, especially endovascular surgeons and other physicians in our kind of work. But I also know they're busy, they're under pressure from HMOs and stuff like that. But if you meet somebody who's done a full Ironman with a AAA stent graft, I'd sure like to know who they are so we can compare notes.
I'll be on the lookout.
Yeah, I'm curious, Dr. John, what it's like. I mean, obviously, you seem very, very shocked. I mean, is it inspiring? I mean, wouldn't you love to see more patients like him coming in? And how inspiring is Kevin, and his story to you? And how do you think now going in Monday and dealing with your patients, will it change at all your mindset in dealing with him? And are you planning to share your story with some of his story with some of your patients to help inspire them and show them what's possible?
Yeah, I think it makes it more relatable if I share a story of an actual patient as opposed to me saying you need to exercise. Like yesterday, I had office hours and I kept telling people you have to exercise. Most of the people I was seeing had heart attacks, but regardless, you have to exercise. And everybody, I mean, we all have excuses, but for me to now say, hey, listen, we just interviewed a gentleman who's going to be 81, who in his, started running marathons in his 50s, had a stent graft at 60 something, ran. I mean, the stent graft itself, those after a while, they're locked in place, and they're very flexible. He's probably not going to damage it. But yeah, hip flexion can maybe create some torque, but be that as it may, it's just inspirational to patients, I hope, because again, I think sometimes they hear what I say, but it's the horse to water theory. So maybe this will help.
John, I did dislocate the left arm of my stent graft. It popped right out of the common iliac back into the aneurysm. It was spotted on Doppler in a routine checkup. And then I had to go to Cleveland for them to fix that. And they fixed it by hooking the left arm of the iliac branch, common iliac branch, back down into the common iliac. They
Mhm.
inserted another stent graft within it via the femoral artery, and it was fenestrated. And they then connected that up to a stent in my hypogastric or internal iliac artery via the brachial artery and back down the aorta. So they did some really
Mhm.
amazing work. That surgeon was done by Tara Mastracci in Cleveland. And I actually interviewed her, and there's a short interview of her by me on my YouTube channel, the Fit Old Dog YouTube channel.
Very
So
good.
twice I had problems with the stent. I mean, a graft, open surgery and a graft, even though it comes with more risks, is a better repair. Is absolutely a better repair than a stent. Twice my stent has failed.
Yeah, I agree. I mean, the durability is much better. However, the upfront cost is a lot less for the stent graft. But
Yeah, and if you've got
yeah,
other health problems, it's probably safer because it's
yep,
almost outpatient surgery, whereas open comes with serious risks.
indeed. All right, I won't. Now let's get to some patients. Douglas, I know you had something.
And I think Douglas walked away for a second. Thomas, did you want to jump back in?
Uh, yeah, just to say I have had an ankle brachial pressure index, Kevin, and so I have 30% flow to my right leg, which is the most affected. I had a contrast CT scan carried out last Sunday, but I haven't had any feedback or results from that. And yeah, what I it started to say and it didn't quite finish was that when I think being diagnosed remotely, as in I didn't even get to see the doctor, I was given a leaflet and told you've got that. And so then, well, in some ways, I guess it was a blessing because I had to go looking for my own information. The leaflet was very basic and it felt somehow random. It gave something like out of 20 people, 4 will experience improvement, 4 will not worsen, 4 will worsen, and I think 1 in 20 result in amputation. And I freaked, and I'm still struggling with that. But then waking up at night with my leg being numb, I was just terrified that I was going to look down and my toes were going to be black, and that was going to be the last time I woke up with 2 feet. And so I didn't know where it was going. After a couple of months and watching a lot of The Way to My Heart videos, I've calmed down a lot. And yes, I've told Kim once she's an angel.
So,
And
Thomas, how old are you?
I will be 58 in July.
Oh, you're the same age as my eldest son. Yeah, no, you can fix this problem absolutely with training and exercise. You got to find something you like to do. What I've discovered is if I push and I manage to run, and I obviously see it's really difficult for me to run, it removes any pain at all I have while I walk. You've got to push the envelope, and what that does, it makes other things easier. So now you're young, you've got if you're getting yourself in reasonably good shape, it's extremely important to do cross training for cardiovascular fitness. I mean, I do Ironman. You're about the age I was when I first did my first full Ironman race. And I trained for that for about 8 or 9 years before I was able to do that. Uh, you are not a statistic. I don't care about their statistics. They're not based on you, they're based on a whole random assortment of people, many of whom are horribly unfit. Have you ever smoked?
Yes, I'm a very bad patient. I've done everything.
Okay, well, get rid
So
of this. Don't smoke. It's
I,
okay to drink.
I've said this to Kim, and I think it's an important thing, and I'm going to keep saying it. Dr. Anita Dua, it was watching. I think it's an old. I've gone back through the catalog, and watching that, which was just a couple of days after my diagnosis, and I had my last tobacco before that. I have not smoked since watching that video. Amazing, and I've told the vascular team everything
Yeah,
about
you
how.
can repair most of the damage. I mean, the body is very adaptive, and so I think you've got a great life ahead of you. Fear is a total waste of time. It just stresses and causes damage. Once you get into an exercise program you enjoy, it doesn't matter what it is as long as you enjoy it. It involves some cardiovascular and some strength training. And then if you go through that book of mine, I list about 13 different things that are important, like balance and posture and things like that. And get that going. You'll have a balanced life. It doesn't mean you can't have a beer from time to time. It's just you can't have one every day. It's a lifestyle. It's a lifestyle, and you can do great. I'm sure of it.
Thank you.
And I want to bring in Douglas. Douglas. And Thomas, you can jump in anytime. You don't have to wait for us to do it. This is a conversation time for all of us. Douglas, go ahead.
Yes, Kevin, you and I talked the other day, and it's been a struggle you getting this information out there to doctors, because I think it was addressed that yours is real world experience compared to book knowledge and what it used to be like. You actually have shown that these things can be done by real world experience. But how hard, what type of struggle have you run into trying to get doctors to understand and to say, oh, that will work, that will work, that will work? Because we're used to saying, I'm diagnosed with this and I can't.
Well, when I first addressed the issue of training with my aortic problems, what I got from surgeons was cardiovascular surgeons writing to me and saying I had no right to give people advice on this. And so they were kind of pretty rude to me. This is a while ago. And I replied that nobody's giving suitable advice. And also, I'm a fellow of the Royal College of Pathologists in London, so I have respectable medical training. And then that quietened them, that shut them up. But none of them have ever communicated with me ever in the last 13 years about my work on training with AAA. When it comes to PAD, what I get is silence. I saw my own surgeon only a few weeks ago, and he had no interest. And Sue was with me, who's a nurse, my partner, and she was kind of surprised. She tried to get him interested in what I was doing, and they're just not interested. They don't. It's like I'm talking Chinese or something. It's really strange because I think they live in a land of surgery and pills, and they feel. I think they get frustrated with trying to get their patients to work out, and they don't. So in a way, I think it's almost not part of their business model. It's just they might pay lip service, but I don't. We have a marketing problem. This is a marketing problem. How to get this across to the physicians. I was extremely surprised in Health when the article about our work in Health Monitor came out. It had no impact whatsoever in people, physicians especially, communicating with me about my work. And yeah, I have medical training. I do not understand why there's this deathly silence.
I'll provide a little
And
color there
before
if
you do,
possible.
I
Okay.
want to just add on to that, just because I'd love to hear, John, your overall perspective, also considering, my experience as well, because I was just at a conference and I have a free or no cost walking program to give to doctors. They tell patients to walk, walk, walk. They complain about not patients not being able to access or not having access to a regimented or supervised exercise program. The AHA and all of the societies just came out jointly with new guidelines that emphasize the supervised exercise program, but at the very least, a structured program. They all seemed interested, but when push comes to shove, only one or two of them actually followed up. Not one of them ordered the walking brochures that explain to patients and give them the extra details patients desire to be able to learn how to walk effectively. And we even gave Kevin's book away at a conference in Chicago last year. Still no follow-up. So I really want to understand, and I think Kevin does as well, and not like you're going to solve, the global issue here, but you might have some perspective as to where maybe all of us are going wrong, and maybe some advice on how we can infiltrate
Can I make a
and create
comment
the
on this?
action we want to see.
Let me make a comment on this. I think this is an important problem and it's a big problem. Can I speak for a minute?
Sure.
Okay, I worked in the pharmaceutical industry for 16 years. And during that time, I tried to sell the idea that the pharmaceutical industry needed a Bell Labs approach to the big problem of integrating pills and surgery with lifestyle. And the big problem is if you influence the patient's lifestyle, it doesn't help your business. You don't get any money for that. If you get money for pills and you get money for surgery. So I think this is very much a business problem. I felt they needed a Bell Labs approach to solving this deep problem within the American medical system. Somehow, how do you create a healthy business model that incorporates pills, surgery, and lifestyle so lifestyle doesn't just become empty words? It's a seriously difficult marketing and business problem.
Yeah, I'll add my 2 cents. So if you look at it from kind of like I guess a teleological framework, the peripheral arterial disease is an illness, a phenomenon where you go to, depending on who you see, you're going to probably get 2 or 3 different treatment options. And of those, it's typically, now we're getting better, but I think typically it is an intervention type mentality. Kind of, you're going to a barber, you're going to get a haircut. And it takes, and this is just me talking, okay? So this is me. My assumption is that it's harder to talk to a patient about changing their lifestyle, eating better, doing X, Y, and Z than to say, you know what, you need a procedure, sign here, and let's go. That is probably where a lot of this inertia comes from. And the radio silence, no pun intended or pun intended, that you hear, Kim, and you hear as well, Kevin.
Well, it's to me a very interesting social problem, a very important business problem. And I felt like a Bell Labs approach would be the way to go. And I could never get beyond their interest in corporate profits. And I understand you've got to run a business, you have to make a profit. And I don't know how to solve that problem, but it definitely needs solving. But I guess it starts when these people are children and they're told how to stay fit and exercise. Maybe it starts in high school when high school exercise is all about winning, which is a huge mistake, a terrible mistake. So maybe this is a deep societal philosophical problem we're trying to tackle.
But you have a couple of folks that have made some comments actually on Facebook on the Way to My Heart's Facebook page. You have Kathy who says, Kevin, you are an inspiration and your book is great. And she's going to be trying out those yoga toes. Also, Tammy is mentioning, she says, this man is an inspiration. I will be buying his book. My next battle is to grow blood vessels below my knees so I can do what I want to do. He has truly motivated me. So you are definitely having an impact, right now, just being here with us.
If I can make a plug for getting reviews on my book, I mean, I have one written review, which is Kim's. I have 7 reviews. One person went on there and said basically my book was rubbish and just left a 1 star. But if we can get more reviews, saying how the book was helpful or not helpful, just honest reviews, that really helps. But people, I don't think, realize that.
I have one more question, Kevin.
Sure.
Okay, Doug.
So on a typical day, can you describe your training methods on a typical day?
Well, when you're training for these races, Doug, there is no typical day. There's a program. Basically, once I'm in full training, and I'm easing back in now because I've started a new relationship and I fell in love and all that stuff at 80. That's not bad. Anyway, but that's another story. It comes down to basically a 3-week cycle, a hard week of training, a harder week of training, and then an easy week. I train 6 days a week when I'm in steady training. I have 1 day off a week. I've been doing this training under a number of coaches for years. Now I pretty well know how to do it. But my training is a mixture, a steady mixture and an organized mixture of swimming, biking, running, and then workouts at the gym. I do most of my strength training in the winter. And once I'm in steady training, and I'm starting to get there again now, having had a pretty busy personal life, I train twice a day. Great believer in lots of short workouts, lots of small workouts a day. I like to do two, and I'm constantly watching for risk of injury. If I sense any strains, then I will back off. And I slowly build my bike distances up to 100 miles, my runs up to, depending on distance, 10, 15 miles. And, and the swims, once I'm in steady swimming training, I do 5,000 yard swims a week, which is not a huge load for a swimmer, but it gets me out of the water in front of my age group. And so, yeah, two often short workouts a week, slowly building and then making sure I rest. So there is no typical day. I'm affected by the weather. I mean, if it's raining, I tend not to bike so much because it's more dangerous because, these slick racing tires on the bike. But it's a matter of keeping the race in mind and trying to get myself to the race start. And I've signed up for a race in November now, which is another half Ironman race. Getting myself to the start line on the beach with no injuries. That's the goal. So, yeah, it's a slow
Can you
build.
describe? Can you describe your diet? Is there specific type of diet that you perform or that you do? You watch for certain things more than others?
Hey, real quick, I've got to run, everybody. Great show. Thank you. Kim, we'll see you later. Bye, everybody. Cheers.
Hey, John. Thanks again.
Thank you so much. Thanks, Thomas.
Thank you.
Go
You
ahead,
there,
Douglas.
Kevin?
Yeah, I mean, about 9 years ago, I went over to a complete vegan diet. I was very strict. Where you have to remember, we're all biochemically different. It's really important to listen to your body when you eat. I mean, you might be fine with, I don't know, cabbages, and another person makes them ill. So you got to listen to your body. But after 3 years of a strict vegan diet, there's no meat, no dairy, no eggs, I started developing nosebleeds on my right nostril. ENT couldn't fix it. And that lasted for 2 or 3 months. It was really awkward. Suddenly your blood starts flooding out your nose. I was missing some nutritional thing. So I started eating a few eggs a week and it went away. It was gone. And so that, once again, I had to listen to my body. My body was telling me I was missing some micronutrient affecting clotting. And so I fixed that. Now I eat mainly vegetables, but I do have some cheese because I'm English and I miss cheese, especially cheddar cheese. I drink wine and beer sometimes, but once I get in training, I have to cut that out because it messes with my training. I like to cook. I love to cook. So I get my vegetables whenever I can from the farmer's market or, a healthy food store. The quality of your diet is very dependent on the quality of the ingredients. You might find that you'll feel really good on rice. I prefer potatoes, which isn't surprising. And so mainly vegetables, to which I add some fish. I found salmon help with my blood lipids. So if I have fish at all, it's usually salmon. Every now and then I fancy cod and chips because I'm English, and so I will cook that. I'm a great believer in everything in moderation, including moderation. You have to party now and then. But I would say predominantly vegetables that I cook myself, and I listen to my body. If there's something that I know I disagree with and my body doesn't like, I don't eat it. I like to have a good mixture of greens, potatoes. I include beans because I don't eat meat. The only meat I eat is fish. And I guess you could say eggs are in a way like meat. I have my own chickens who aren't laying so well lately, so I get the eggs from the farmer's market, and I know they're good quality eggs. So basically, quality of ingredients, cooking the food yourself so you know what you're eating, and listen to your body, really. And as my training ramps up, I have to increase the amount of carbs and fats that I eat for energy. Um, and so for a while, I went on a complete paleo diet, totally, largely fat and meat and stuff like that. I wrote about that. I managed to almost complete an Ironman without eating almost anything during the race because I went ketotic. Uh, the thing is about diet is to fully understand diet, you need to have some understanding of biochemistry, which can be a pain in the ass for some people to read. I mean, I read it for fun. But yeah, good ingredients, um, and listen to your body. I think those for me are the two key things when it comes to diet. And eat what you like. I don't mean eat junk because you like junk. That's just bad training. Did that answer your question, Doug?
Absolutely. Can you go back to the toe thing and discuss the toe thing a little more for those that may not know?
Yeah, because
Okay.
we're getting questions as well. Douglas, thank you for bringing that up. We're getting some questions online from people who want to know when, how many times a day. And I do want to remind people, and especially we did have a disclaimer in the beginning of the show at the end of the regular show, but I also want to remind that before you start any exercise program, make sure you do check with your healthcare professionals to ensure that it's right for you. Every person presents differently with PAD. And so we have our little disclaimer that says, just make sure any information or advice here, do check with your healthcare team before acting on anything. And then with that being said, Kevin, you have the floor.
Okay, the reason to spread your toes is to spread your metatarsals, the long bones in your feet, because there are blood vessels that lie between those bones, and you don't want to compress them. When your feet hurt, there's a tendency to squeeze them tight together because it hurts. That is exactly the wrong thing to do. That decreases flow through your feet. If you go to my YouTube channel, Fit Old Dog YouTube channel, and you go to popularity, the very top video shows you how to use yoga toes. And it's a video by Rebecca Amos Lawson, who co-authored one of my other books. And she is a body movement expert, and she describes how to use yoga toes. And they're just designed to spread your toes and counteract that tendency for tube socks and small toe boxes to narrow your feet, which really reduces flow through your feet, which of course will inhibit blood to your feet and away from your feet. So a big toe box, spread your toes to spread your metatarsals and use the muscles in your feet. You will find with work, it doesn't happen overnight, that you can quite dramatically improve oxygenation of your toes, and you've got a fair chance of keeping them. That you can check with an O2 SATS meter on your toes, and that's mentioned in one of my books. Did that answer the question?
Yep. And we also got a question about LDLs in the book. There's she's known as Kim on there, and she is wondering about the significance of the LDL because she doesn't see the nutrition discussed. She follows the Estelin diet, is very happy with the Estelin diet, but it's interesting, and the struggle that I had when we were trying to change my dad's diet and figure out the direction to go for his nutritional program when he was diagnosed with heart disease was exactly what she is saying, that when you look at the Esselin books or Dean Ornish books, a lot of it's really tough to understand, and for just the layperson. And also it doesn't explain the mechanism of action in a way that the layperson will understand. And the best explanation I ever had on the LDLs was from my dad's dietitian who was going for her PhD. And she looked at things a little bit differently, kind of like you do, Kevin, just in very simple, logical ways. And she said, the reason that 40% of people who suffer a heart attack have normal cholesterol in the basic lipid panel is because the doctors are not digging a little bit deeper. They'll say, hey, your cholesterol is normal and you're fine. And it's really not the case. There are different levels, right? There are different types of LDL particles, the so-called bad cholesterol. You have the large fluffy ones, which are great. You can have a lot of those. You can even have high cholesterol. And if you have more of the large fluffy ones, you're not as likely to get into trouble with those. But it's when you have that imbalance, you have more of those small, dense LDL particles that when they become oxygenated by the trans fats and free radicals, they could eke into damaged areas of your arteries and push that wall up and out and block the blood flow in your arteries. And so it's always important, I say, to get the advanced lipid panel to understand your particle number and understand the quality of your LDL particles and your cholesterol versus just the quantity. But from your perspective, Kevin, because I know you've done a lot of research on this as well, what are your thoughts?
Yeah, my problem was an LDL, low density lipoprotein problem. It was not a cholesterol problem. It was very, very severe. And I would say the most important thing to focus on is your HDL, because HDLs, high density lipoproteins, are involved in retrograde transport of cholesterol particles out of your tissues. And so a high HDL is a good thing. And the only thing that helped my HDL go from under 20 to up to 80 milligrams per deciliter was exercise. And Ironman completely literally fixed my lipid profile. And so, but it's a lot of exercise. And most people were, I remember one person wrote to me and said she'd rather lose her feet than do an Ironman. And I'm like, well, I guess that's your choice. All I know is that within a year of full Ironman training, which is a lot of exercise, my my triglycerides were down below 150 and my HDLs were up at 80, which completely reversed. My plasma was completely clear when you spun it down for hematocrit. So yeah, get to know your fats. Fat biochemistry is highly complex. It really is complicated. I don't claim to know it very well because I haven't been researching it lately. And all I can say is diet helped a bit. Statins didn't help one little bit, and they were totally inappropriate. And exercise completely reversed my problem. That's my main experience as, an experiment with an N of 1.
And my dad also they did some advanced testing through Boston Heart Diagnostics. Because as you mentioned, not everyone is created equal when it comes to the presentation of vascular diseases. And you really have to understand your presentation of disease and push your doctor to get to the heart of it, to really get to the bottom of what are your risk factors, what are the factors leading to your situation. It's very easy for them to look at the textbook and say, for every single patient, standard protocols, even the new guidelines from the AHA and other societies that just came out on the 14th of this month, said that standard treatment includes statins for every single patient. And for my dad, though, with heart disease, it wasn't appropriate, according to ultimately his cardiologist that looked at the Boston Heart Diagnostics, the advanced blood work that we got through them, which is covered through most Medicare. You just have to find a doctor. You have to go to their website, Boston Heart Diagnostics, and ask them to find a doctor near you that is to date on their diagnostics and can order it from their particular practice. But my dad found out that he didn't have a liver production problem, which is what the statins actually tackle. He had a cholesterol reabsorption issue. So as you said, Kevin, those HDLs are the export, right? They're the transportation for the LDLs to get them out of your body. And how do you get them out of your body?
You got to get your HDL up.
You got to get those HDLs, right? You got to get those up, get more transporters to get them out. But also, you have to, once they do drop off the packages, you got to push them out of the body, right? And
Yep.
my dad ended up having a cholesterol reabsorption problem because once the HDLs were dropping off the packages, they weren't getting excreted. And he basically was not having enough bowel movements. And so his dietitian had said, listen, men on an average day should have a bowel movement 2 to 3 times, especially if you do have this issue with the cholesterol, particularly those small, dense LDL particles. And as soon as we worked on that with a functional medicine practitioner in partnership with his dietitian and partnership with his cardiologist, it was great because when you find open-minded doctors, they'll all work together. And it's fantastic how they work together to get them on the right probiotics, prebiotics, the right soluble fiber levels, et cetera, et cetera. His cholesterol went right back down. Everything, all of his lipid panels ended up normal. Even the advanced lipid panels, they looked even better than mine. And I haven't been diagnosed with anything except I've joined your group, Kevin, because I was found to have um, a thoracic aneurysm. I haven't been checked for abdominal yet. I need to do that, but
What size is your TA?
3.7, it's in the aortic root. But they said for my frame, my size, most doctors would have brushed it off, but they're concerned. They're now sending me for advanced testing, connective tissue testing with at the university nearby, UC San Francisco, because they're concerned since my mom just passed from an aneurysm that was undiagnosed despite symptoms. I get so tired of people saying it doesn't have symptoms. I'm sorry, there are some symptoms, and especially when
Absolutely.
she went to 4 doctors in a matter of 2 weeks and they all brushed it off, um, with clear symptoms by that point. It was like, "Hello, hello, what's going on?" And then finally her body just couldn't take it. But you know, it's my brother has a bicuspid valve defect and also 3 aneurysms, I think now. I think he has a couple of the valves and one in his aortic root. Um, and so they're wondering if there's something more genetic in our case, as in your case, that is making our connective tissues a little weaker. So we're going to explore that.
There's one thing about drugs I like to mention. Statins are muscle toxins. I've seen the legions. They induce basically rhabdomyolysis, which will counter any attempt to use exercise to fix your lipid problem. Number two, beta blockers, which in my opinion are overprescribed, will also prevent you from exercising and get your heart rate up. Those two drugs have to be used totally appropriately, and they are horribly overprescribed. So if you're recommended a beta blocker or a statin, I suggest you think carefully about it if you want to use exercise to fix your dyslipidemia.
But you have to also be honest with yourself and the reality of what you're willing to do. And you have to put in a lot of effort, a lot of energy. You got to take your health into your own hands. You have one life to live, right? And you have to decide that you really want to live it and that you can live it. But for every person, it doesn't mean you're a bad person, doesn't mean you're less of a person if you decide, you know what, it's just not right for me. And I want to live the quality of life I can for as long as I can. Um, and it's different for every individual. So I don't want anyone to walk away from here feeling bad because of the choices that they're making. But it is different for every single person. And, Kevin, you are an inspiration. You do show what is possible with a lot of work, a lot of energy. But there are some people that wonder that, for example, with my dad, that you're pushing yourself, and then what sucks is then you end up with that need for a hip replacement. My dad ended up falling, and he's never been able to get back as active as he was, despite him trying to push himself. And so he ended up with yet more plaque progression in his heart, another heart cath with a couple branches of his right coronary that had increased in stenosis to the point that it was in fact affecting his ability to breathe properly, as the right coronary sends blood flow into the lungs. And so um, I know you can't live your life in fear, but it's tough mentally to deal, with getting back once you do have that type of injury to where you were.
Somehow you got to maintain a sense of humor and appreciate what you do have right now. I think that's the trick. Eventually, entropy is going to tear us down. This reminds me of my favorite bumper sticker, which is eat right, exercise, die anyway, which is true. We're all going to have to face death eventually. But I would say let's think about what we have now and enjoy life now, because that's what we have. One book that helped me a lot with that was The Power of Now by Eckhart Tolle. It turned off a lot of this negative talk in my head. And I would say I tend to live in the moment. I live in the present and not think so much about what's down the road, even though, I like to, prepare for the worst and hope for the best. So, yeah, it's each have to choose. You're right. We're all different biochemically, mentally, our experience of life, and at least there you don't have to feel like you can't do anything. You definitely can.
I appreciate that. And Kevin, I don't want to take up too much of your time. We really appreciate you joining us. If there aren't any, I'll give one last chance for final questions from Kevin or for Kevin, and then we're going to wrap up for the day. But I appreciate everyone joining us. Does anyone else want to jump in with any other comments or questions? Joshua, maybe if there's any other comments coming in from YouTube or any of our other social media, it would be great to bring them in now. I'm going to double check really quick and see.
So I got a quick one. So would you suggest like starting off at a 5K or a 10K or one of those just to get motivated enough to continue to go and advance? Not all of us are going to be able to run a marathon. We know that, but are those good ideas?
Yeah, I mean, I do the local races, which are, they range from 5Ks to 10 miles, the local runs, and you can walk them. There's people at the back. So you start by walking the race or walk running the race. And then after a while, you might be able to slowly run the whole thing if you are a runner, but you need to run right. You need to run injury free, low impact. Running is very prone to injury. And this is why I do quite a bit of water running, which is not so injury prone. In fact, it's pretty safe. I cross train. The bike is probably the most dangerous thing I do because of the traffic. And I would say pick a 5K, which is 3 miles basically, and be prepared to walk part of it and just see how you feel. And if you get to the point you can complete, a 5K local run race and you meet people there, then you can slowly build from there. But you have to know how to run. You have to know how to run without injuring yourself with low impact running. I think there's a video on my site about that, but I always recommend if anybody wants to run, they should read Jack Hagee's book, Running with the Whole Body, and they should study Chi Running by Danny Dreyer because they're really good. And when I had my third knee surgery, 2 of which were due to running injuries, I studied those 2 things and converted to a low impact shuffle run. And doing that, I managed to run the Boston Marathon in 67. So you can actually get up a pretty good pace. Qualifying for Boston was probably the toughest race I ever ran in my life, the qualifier itself. The actual race is a big party. But yeah, just find a local 5K, which is probably the shortest distance, 3 miles, and be prepared to walk, run it, talk to people at the back of the pack. Oh, and by the way, Doug, you actually meet the nicest people at the back of the pack.
He's trying to unmute so he can comment on that.
And when I raced bicycles and I swam for Lamar University back when I went to college. So yeah, those are the ones, we talked while we ran and the biking,
Yeah.
it was a competitive spirit, but it was all of us together.
So you were a college swimmer?
Yes.
Well, you'll swim better than I ever will. I mean, when I meet a college swimmer, they can look completely out of shape and they can swim me into the ground. The college swimmers are really something. And
What type
so,
of bike do you have?
what kind of bike?
Yes, sir.
I have 2 bikes. I have a Guru, which is carbon fiber and it's kind of mushy, and I have a what is it? A Karma, which is a titanium alloy bike, which is really good, especially for hill climbers. But they're both custom bikes that cost thousands of dollars that were designed to fit me personally using a bike fit. So they're high end bikes, but the bike I ride now cost me $9,000 years ago, and my car cost me $2,000. So that tells you where my priorities lie.
For those that want to bike, just your normal bikes just to start off are good, aren't they?
You can get a perfectly good bike for $300 if it fits you, but it's got to fit. Fit is more important than components, more important than anything. The bike has to fit. And you can get a bike fit for a couple of $100 probably, or in a bike shop for less than that. And then you'll make sure that everything is right for your frame, because people often have bikes that are too long and then they get lower back pain, right? Or they have a saddle too low or frame too small and their knees are too close to their body, which is a really bad thing. So the bike fit is more important than the bike. I mean, one of my sons got a $300 bike that fit him well, and it was as good as my $9,000 bike for him. It's just that my $9,000 bike probably weighed half of it and made a big difference to my races. But I mean, that's what I did. But no, you can get a very good bike if you look around, but you got to get a bike fit, and a bike fit will tell you how long to have the top tube, how far from the pedals, where to put your feet on where to attach your cleats to the pedals. The bike fit is really important.
And what about your shoes for
Oh,
running?
running? Yeah, it's funny. I run my shoes into the ground until they fall apart. Basically, I'm interested in having a piece of rubber under my feet to protect my feet, and have a wide toe box, and that's basically it. If you read Born to Run, don't run barefoot unless you want to injuries, but there's some pretty good stuff in there about running. So I wear shoes until they start falling apart. They're generally zero, they're pretty flat shoes, and I let my feet do the work. I just have a piece of rubber under my feet to stop me cutting my feet. So that's my approach. I don't listen to the shoe industry trying to change your shoes every few hundred miles. They're just making big bucks. Spread your feet, use your feet, make sure your feet have room to move, but don't slide around. For a while, I had PAD associated corns in my right foot. And the way I got rid of those was to dump my socks. And so now I don't use socks in my shoes. I put socks in my hiking boots to keep my feet warm when it rains, but I can still feel they kind of rub my feet. So I dump the socks. So shoes, wide toe box, comfortable shoes, whatever works for you. You might get some help from a PT on advice if you're, you want to move properly. You don't want to heel strike. That's important. You don't want to push off your toes too hard. That causes injuries. Supination and pronation are not such a big problem. Alignment and having your hip rotators right is really important. So I would say shoes that fit you comfortably with plenty of room to move, and steady body movement. For that, Feldenkrais is the best tool. I don't know, did that answer you can run in your shoes till they fall apart as far as I'm concerned. Yeah.
Excellent.
Is anybody left? Are we just talking to ourselves here, Doug?
Nope, we have quite a few people that are still in our live studio audience here. And we have Josh that is asking, actually making the comment, 6 years to learn to run. Wow, how did that go? How did you maintain any sort of hope that you were going to be able to run in the way that you wanted to run over the course of 6 years? There had to have been micro goals. They always say that it's great to have, you were mentioning earlier in the show, yes, have that goal, have that marathon, but over the course of 6 years, when you're trying to learn in the way you said it, learn to run, how did you maintain a hope and maintain the course?
Okay,
Did you set these smaller milestones?
Yeah, there were two phases in my learning to run. The first phase was before I had PAD, and I had to learn actually how to run without injuring myself. And I had a problem of guarding a broken ankle that caused me lots of trouble. All that's listed on my website. So learning to run originally back in my 50s so I could run a marathon, there I had to get rid of that guarding injury and learn how to run without impact stress and not have any more knee surgeries, because that really sets your training back. Anyway, but learning to run with PAD, it's this endless battle of trying to fine tune the way I run. And I learned one thing after another, which is in the book. First of all, starting with low impact, and then starting with, softening my feet. And I was already running with my whole body. And then the spreading of my toes and the contracting of my toes. These things I gradually added to my skills over a period of 6 or 7 years. And now they're kind of built into the way I walk and run. But I'm always looking for the next trick. Oh, there's one trick I always forget to mention: the power of your mind. One thing I do quite often, especially when I'm lying in bed and I feel the flow to my feet isn't that great, I'll wriggle my toes and I will mentally send blood to my feet. And I am sure it actually helps. There is actually a power within our mind to improve our body's blood flow and our strength. I know that imaginary exercise is used to help people get out of bed after they're confined to a hospital bed for a long time. So never forget the power of your mind to actually improve the way your body functions, because it's a conversation between your mind and the rest of the body. And so, yeah, so I would say it took 7 years to be able to run again, not run like I used to, but run enough that I can complete at least for now, a half Ironman race. But I just kept adding new tricks to my smorgasbord of ideas to improve blood flow. Did that answer the question?
I think so. I think that you did. Yep. Josh says you did, which is great. Um, is there anything else? You have it's a very, big book, but I'm wondering if there's any other before we run and we close up shop for the day, and let everyone, out and about to enjoy some of the sunshine. Um, any other tips? You mentioned that there were what, 9 or 10 different tips, including the toes, including no socks, things like that. Is there one more that you can give us to close out the show?
I think setting steady goals is very helpful in monitoring your goals. And it's extremely important to monitor how the blood flow is getting to your toes with an O2 sats meter, and learn to relax into pain. Remember, there's good pain and bad pain. And if you fight the pain as opposed to relaxing into the pain and watching it, you'll find the pain can't control you like it does. So having the right relationship to the pain of claudication or numb feet, it's a mental game, and make it a game, not work. And it's a conversation with your body. And so I would say not letting pain cripple you and prevent you from doing the things you want is really, really helpful.
Thank you so much. We really appreciate you, Kevin Morgan. He is an amazing friend to the Global PAD Association and advisor. He's also the author of 2 books you can find on Amazon: How to Train for Aging and How to Fight the Crippling Pain of Peripheral Artery Disease. You can also get a subscription to his newsletter for free. Also, he said he has ebooks for free for his books on his website, inspirationalselfhelpbooks.com. Thank you so much again, Kevin, for joining us. You're always an inspiration, and we appreciate you being here.